Welcome to Through My Eyes Nursing Stories. My name is Festus, a dedicated nurse sharing real-life experiences, lessons, and reflections from the world of healthcare. Here, I talk about what it truly means to care, from moments in the ward and operating room to teamwork, challenges, and personal growth in nursing. Today, I was privileged to be part of an orthopedic theater team performing a total hip replacement for a 73-year-old woman with a neck of femur fracture. I served as the scrub nurse, working alongside the orthopedic surgeon, assistant surgeon, and anesthetic team. The patient received spinal anesthesia, and the procedure began smoothly. Midway through the operation, bone cement was applied to fix the prosthesis. Within a few minutes, we noticed the patient's blood pressure and oxygen saturation dropping suddenly. And soon after, no palpable pulse was detected on the monitor and subsequently on the carotid artery. The anesthetic team immediately initiated CPR, and after a few tense minutes, we achieved return of spontaneous circulation. As we proceeded with wound closure, the patient again developed cardiac arrest with arrhythmias on ECG. The team quickly started advanced cardiac life support ACLS for about 40 minutes, and thankfully, the patient was successfully resuscitated. Later, after consulting the surgeon, I learned the patient had likely suffered from Bone Cement Implantation Syndrome, a rare but serious complication associated with orthopedic procedures using bone cement. At that moment, I felt a rush of anxiety, tension, and deep responsibility. It was frightening to see a patient go into cardiac arrest right in front of us, not once, but twice. However, being part of a coordinated, skilled, and calm multidisciplinary team gave me confidence and reminded me of the importance of teamwork in the operating room. From a clinical point of view, Bone Cement Implantation Syndrome is a rare but critical complication. It taught me how close communication between the scrub team, surgeon, and anesthetic team can make a difference in outcomes. It also emphasized why understanding the physiology behind each surgical phase, including cementation, is vital for perioperative nurses. I'm grateful to have been part of such a resilient and professional team today. This experience has strengthened my confidence, sharpened my clinical awareness, and reminded me why I chose nursing to be there when it matters most. If you enjoyed this video, don't forget to subscribe for more content like this. Turn on the notification icon so that you cannot miss my next episode.